about, we're not going to do physical skills today, so I apologize for that. But what we're going to talk about is how to make you better able to use your skills when you need to use them most. We're talking about optimizing provider performance. So, for you, sorry, the one person that doesn't know me, my name's Jack. I'm a paramedic with the local transporting agency. Going into medical school next year, and this is just kind of one of my, this is kind of a pet project, one of the topics that I'm really interested in. No disclosures, no one's giving me money, it says. But a lot of the information that I'm using is coming from this guy, Mike Loria. He is a current medical student at Dartmouth. He flies with their critical care air ambulance, DART, and he is a former United States Air Force PJ, which is a really big deal. It's kind of like the badass of the badasses. When special ops gets into trouble, the PJs go and get him. And so this is really his baby, how to make human performance better in stressful situations. And a lot of the stuff that he's done has showed up on mcrit.org. And you'll see on your handout there's a URL right under my name. And that has all of the resources listed, all of the blog posts, a works cited page, anything and more that you might want to know about this topic in more detail.
Did he actually give this thing back in Dartmouth conference by any chance?
I don't know.
2 years ago, I remember something very similar.
He could have been there.
Yeah.
Because
He's a flight paramedic or something?
Yeah, for DART.
Yeah, I'd be interested. Yeah, it was.
So this is my take on it. This is, he talks a lot for like critical care providers. We're going to bring it to BLS everyday pre-hospital care. The original, I did something like this 2 or 3 years ago for this conference based on stuff from this book, On Combat by Dave Grossman. He looks at the physiological stress response in police officers and soldiers in combat. And if you're interested in going into emergency medicine or responding for the rest of your life, I highly recommend checking out this book. It's really, really good. So, optimizing responder performance. What does that mean? Basically, what we're going to focus on for about 45 minutes is how to make ourselves better human tools. One of the military sayings is humans are more important than hardware. And we want to focus on how to be our best despite whatever might be going on. How can we set ourselves up to perform to the best of our ability? So there's this idea of flow. Do you guys play sports? Anyone play sports? Have you ever been just on like something, whatever it is, something in the water, something in the air, just is allowing you to get everything right, do your best. And the way that psychologists think about this is you've entered this state of ideal engagement. So you are meeting a challenge with a high challenge with a high level of skill. And this is a really cool graphic. I really have spent a lot of time thinking about this. So as the challenge increases, if the challenge increases without you having the skill to meet it, you might feel worried or anxious. But if your skill is higher, like so, my job at the moment is kind of boring because I just drive old people from hospitals to nursing homes. I feel like my skill level, I've trained more than an Uber driver is, so I become somewhat bored or relaxed at my job. But in those occasions where it's hit the fan and things have gone downhill and I have a critical patient, I try to make my skill level meet whatever challenge it is that's facing me so that I can enter into that flow pathway. So from here on out, what we're going to think about is how can we bring that level, that perceived challenge. It's not always that the challenge is really that hard, but what we perceive it to be, and how can we make that meet our skill level so that we can enter into a state of ideal engagement. So, 3 kind of steps, generally speaking, that you could do, or 3 steps that you could take to set yourself up for success. First 2 we're not going to spend much time on. but you gotta know your shit. You gotta know what you're doing, you have to have the skills, and you have to have the knowledge before you can use them to the best of your ability. That's for your educators and your trainers. We're not gonna spend that time actually going over your skills. We're gonna talk about how to use them to the best of your ability. The next step is kind of a talk unto itself. It's about preparation and cognitive offloading. So preparing could be everything from how do you organize your service, how are you staffed, how is your jump bag set up. Having everything around you set up and prepared to enter into those stressful situations when you need to. People in the last group were talking about how when they get calls at night, they lay all of their clothing out in the same way every time. So you don't have to think about what you're going to do to get out the door. And that, in a way, is a form of cognitive offloading. So the idea is that if there's something in your head that you can prepare and set aside, do it. In the moment, in the stressful situation where you're doing a task or doing a skill, you don't need to be focusing on anything but exactly what's happening. So for me, when I'm going to a call, well before I get on scene, I put my gloves on because I get sweaty palms sometimes, and my hands are like in between the medium and the large, so I don't want to be there pulling each finger down as my patient's like gasping for air. It's really embarrassing. I'm going to become stressed out and not think about the steps that I need to take for them. I also will prepare with my partner. If it's a bad call, say, okay, I want you to bring in A, B, and C, and the first 3 things that you do should be 1, 2, and 3. That way, as soon as we enter in, we're on, we're ready to go, and we don't have to think about that. Another way is to have a checklist. So this is an intubation checklist from MCRIT. This is a really complex one. I have something much simpler in my airway kit. It just reminds me of the individual things that I need to have accomplished before starting my airway management. So you could do this for any given skill that is going to be somewhat similar the whole time, or any time that you do it. Surgeons use checklists. There's a whole book about it, the Checklist Manifesto by Atul Gawande, which is pretty good. Haven't thought of any great examples for BLS providers, but if you think about, like, if you transport someone, there are certain things that you need to accomplish. You need to make sure that you've done critical interventions, you've gotten a set of vitals, and you've called into the hospital. If you had trouble remembering that, there's no reason you couldn't make a little checklist for yourself. So, aside from knowing what you're doing and preparing to do it, we're going to spend our time thinking about how to engage and how to disengage. How to be in the moment and performing to the best of your ability when you really need to. So, when we have those bad calls, when we have critical patients, it's stressful. There's never going to be a point in your career when you don't have something unexpected confront you. So we need to be prepared to combat that stress. We need to know how to take that stress response, that perceived challenge, and bring it back to some place where we can meet it with the skill that we have. So we're going to talk about stress exposure training kind of generally. And this is something that Mike Gloria kind of outlined, 3 different steps. And those are information provision, skills acquisition, and then application practice. So what happens when we find or encounter stressful stimuli? We need to know about it before we can do something about it. Then we need to know what skills we can practice and how to practice them. So in his book, from Lieutenant Colonel Dave Grossman, he talks about what happens to police officers and soldiers when they get into firefights, when they have the most stressful of stressful moments, when someone's trying to kill you. And he talks a lot about the sympathetic response and the physiological things that happen in our body because of the stress, because of what our mind is going through. And he breaks those down, that stress response, into conditions. So it starts with white. White is like you wake up on a Sunday morning, the sun is shining through the window, you swing your feet off the bed, you are not ready to do shit. Like, someone could come and slap you across the face and you wouldn't be ready to do anything about it. This is completely disengaged, completely at rest. We spend most of our time in yellow. This is where you're active, you're up and about. You actually have your fine motor skills are the best that they're going to be. And complex tasks are going to be completed to the best of your ability in this kind of alert but not an overdrive stage, condition yellow. Red is where soldiers want to be if they're becoming engaged. You have the best gross motor skills, and you also have the best visual acuity, the best cognitive response time in this condition red. Again, heart rate here is being used as just a marker, like a placeholder to signify the rough transition between these stages. So that's where Grossman wants to keep his soldiers, but what he's fighting is the movement into condition gray. So this is where you get tunnel vision, where you get auditory exclusion, and someone might be telling you something, but you just don't hear them because you're so stressed and focused on what you're, like a specific task. This is where police officers might be in an engagement and firing their weapon, but don't hear the shots ringing out. And obviously that's not bad, you're losing your ability to perform. And then worst case scenario is you enter into condition black, and this is where you literally shit yourself. You are useless, you freeze up, and you can't do anything. So we're staying well away from that. We're going to stay in between yellow and red. We're going to stay nice and orange. So we have our best motor skills, fine motor skills, but also the best visual acuity, cognitive abilities that you get from being kind of completely immersed in a task or skill. And what we want to do is create a little plateau for ourselves here. So as your stress response increases, your skill kind of waxes and wanes. It gets better and then it gets worse. But we want to create a plateau for ourselves where we can keep our skill high despite an elevated stress response or an elevated challenge. So how do we do that? Well, one acronym that Mike uses is Beat the Stress Fool. Another one that he uses is Beat the Stress Foolish Padawan. So we're going to go through these. Breathe, talk, see, focus, and then posture is the last one. So we're going to call these performance-enhancing psychological skills. So things that we can do for ourselves to make our performance better. So the first one is breathing. Breathing is the only autonomic nervous system function that we can control. It has this intrinsic link to the nervous system. And we found that it affects our mood, it affects our behavior, and it affects our ability to perform. You might see professional basketball players. What do they do before they take a free throw? Bounce, bounce, bounce. Deep breath. It calms them and not only lowers their heart rate, gives them some kind of physiological calm, but it also gets your mind somewhat at ease. In the military, they use tactical breathing for special forces. And this is where, in caveat, anytime I'm talking about breathing deliberately, think about getting your belly as big as possible. Don't look at each other, it's embarrassing. But get your diaphragm as big as you can and really expand. Think about every little alveoli blowing up with air. And then when you breathe out, get all of them closed. Get as much air out as possible. And so tactical breathing is you breathe in for 4 seconds through your nose, completely expanding. Hold it for 4 seconds. And then breathe out for 4 seconds. Again, everything out, and then hold it out for 4 seconds. And so not that you need to do this every time, before you start the patient encounter, but if you really find, I do it after a run, for example, if I'm trying to bring my heart rate back, or if I get a really gnarly dispatch, I might take the time to do that whole cycle of tactical breathing. But one big deep breath might just be enough for you. The next thing is self-talk. So this is the Thomas the Tank Engine method, right? So instead of sitting there and thinking, oh my God, like, I've never seen an airway like this, I'm freaking out, I don't know what I'm going to do. If you have some form of motivational, instructional, or just positive self-talk, it can make a difference in your ability to have those mechanical skills that you need. So this could, in medicine, be a specific mantra for a skill. So say you're worried about your ability to assess a patient. Like you get a gnarly dispatch, someone just got whammed by a truck or something, and you're getting there and like, God, how am I going to approach this? Just remind yourself, airway, breathing, circulation, or massive bleeding, airway, circulation in the case of trauma. Anything that is going to instruct you in a positive way will better prime you to perform. The next one is visualization, C. So the idea here is that, and this is something that sports psychologists have studied for ages, but if you visualize yourself performing a task, it's almost as good or as good as actually doing a dry run. If you could like hold the thing that you're thinking about using, even better. But it's not just sports that do it. There's this really cool example I found of the Blue Angels practicing visualization.
The team undergoes a routine pre-performance exercise led by the boss.
Really want to nail, we're still seeking that perfect show.
Every show site is unique. Every flight has its unique challenges, but the simple matter of the fact is that we do almost the same thing every day, and the hard thing is battling that complacency. The way we combat that is through a practiced focus. The devil's in the details, and all of the attention to detail lends itself to a much safer demonstration.
Soles being from the right with a tuck over roll.
Part of that focus comes from an unusual training exercise passed down through generations.
We go.
They perform a ritual that's like a form of meditation. It prepares the pilots for what's to come.
We're behind the ground, set up the fan brake. Pumps off. Pumps off. Smoke off. Push.
They call it chair flying, and it is just that.
Airspeed calm. Calm and left.
The chair flying that we do in the brief, it serves a number of purposes, and for me it allows me to get my mind ready to go out and do the air show. It also allows the boss to get ready to kind of get in his zone, and we'll make all the same movements, we'll make the same throttle corrections, stick inputs, everything, while visualizing exactly what's going on. To me, it's a great benefit and a really important part of me getting ready to go fly.
So we're not fighter pilots. We're not doing the same exact thing every time, but we do have opportunities to think about what we're going to do before we do it. And this, again, we're going to talk about disengaging and how to give yourself that chance to visualize the task at hand. But for me, some of the things that a paramedic can do, I might never get the chance to do like a crike. So our crike kit is in the airway cabinet, and I look at it every day. Every day I check my truck, I look at that crike kit, and every once in a while, if I'm just feeling, I don't know what it is, but I'll take it out, and I'll sit there, and I'll close my eyes, and I'll feel the contents in the kit, and I'll say, okay, got my patient, I've identified the landmark, I'm going to stretch the skin, I'm going to make a deep single incision vertically, I'm going to palpate the membrane, I'm going to puncture the membrane. And in my head, I look at it, and crike happens to be a skill that's mostly non-visual anyways, so doing it with my eyes closed is really beneficial so that I have the idea of what I'm going to do before I ever have to do it. You can do this with anything, any skill that you might want to do or that you might be nervous about. So before we do that, before we enter into doing that skill, we need to really make that leap of faith from, okay, I'm going to get ready, to I'm going to act, I'm going to perform, and I'm going to be on. The way that we do that is by focusing with a trigger word. So this might be, for example, the first time that I cardioverted someone, so shocked someone who was awake, I was a new paramedic, and he was in ventricular tachycardia, which is like one of the two things that an AED sees and says, oh bad, electricity. And this guy looked like crap, and it was a stressful situation because we were in the middle of nowhere, and he's on the couch, and there's like anxious family around us, and I took the second we had the pads on him, I said, sir, your heart isn't doing what it should, and your pacemaker defibrillator isn't doing what it should, so we're going to have to do that for you. And then that was kind of my, okay, I've got my breath, I've gotten ready, I know what I'm doing, I know that I'm doing it right, it's the right time. Then I charged the monitor, said, charging, I'm clear, you're clear, shock delivered. And that was my, okay, now I'm on, I'm in it, I just shocked a guy, so I better not screw the rest of this up, otherwise it's gonna look really silly. And it doesn't have to be something that you say out loud, it can be in your head, okay? Let's go. Just to get yourself over the edge and into the moment. The last thing we're going to think about as a skill that you can practice is pose. Have you guys seen the TED Talk by Amy Cuddy on power poses? It's really good. So this psychologist did a study where she looked at people going into a job interview. And the control group just went into the job interview beforehand and they just sat there like you would for a job interview. Went and did their thing, fine. The test group, however, found somewhere where they could do a power pose. So feet apart, arms up, shoulders back, head up, arms up like this maybe, or like the victory pose, whatever it might be. They found a way to do it for like 5-10 seconds. And what she found was not only did these people perform better in interviews, and they felt like they could take more risks, but they actually increased the level of testosterone in their body and decreased the level of cortisol in their body, the stress hormone, just by adopting a power pose before going into a stressful situation. So it's bad if you go in and you find your patient on the ground and you start standing over him like Superman. That's embarrassing for everyone. But the way that I practice this is I'm walking into a house, I just adopt a stance. It's like I have a paramedic voice, and I also have like a paramedic pose. And I walk into a room and I want everyone in there to know, okay, I'm in charge, it's okay, and I'm the person that you're going to be talking to. And just by holding myself in that way, I'm preparing myself to do the job that I need to do and encounter whatever challenges might be ahead. So there are a lot of ways that you can practice these techniques, or there are you can also, when we're talking about applying and practicing these skills, it could be for specific skills that you are using as an EMT as well. The military, when they practice stress exposure, this is a picture of what they call pool competency, and it's a nice way of saying drowning people. We're obviously not going to be drowning each other, but what we can do to practice stress is setting up any kind of stressful situation, but you want to do it deliberately, I guess is what I'm trying to get to. We want to have a situation where we can think about and oh gosh, I had a good word for this earlier. We want to focus on a specific task and how we're going to do it, kind of break the skills down, have the individual components be what's in our head, so that when you go into the situation as a whole, that specific skill has been deliberately rehearsed time and time again. So this is a quote from a study by this guy, K. Anders Ericsson, who does several studies on deliberate practice. And this is kind of, his whole thing was what makes experts different from average adults. And what he found was that experts have done deliberate practice. They have practices or a lifelong period of deliberate effort to improve performance in a specific domain. So when we're practicing these skills, do it deliberately. Think about it deliberately. I still do it, go into calls. Like I said, I'm just a proponent of these things. I'm not an expert, but they work for me as far as I've seen, and I still keep them in my mind so that I may be able to overcome those stressful situations as they occur. The other thing that's worth mentioning is that if you create stressful situations in training, if you have or if you do stress exposure training for your group, one of the most important things is that everyone comes out a winner. So you can't, in the military, no one dies in training. If you fail in training, what you're doing is ingraining failure. And that's really bad for moving forward as a provider. And it's not a good leadership practice either, for that matter. So if you do stress exposure training, make sure everyone comes out a winner. If you do it for yourself, make sure that you feel successful after having done it and feel like you've gotten something out of it. And when we're doing all of these things, we're in the moment. We're managing the stress and the difficulty that's in front of us. But in order to really do that and to continue to do it, we have to have moments where we can disengage, where we can step back, where we can regroup, rethink, and then re-enter with the same vigor that we had started it with. So it helps to find pause points, pause button. One of the ways that you can do that is by taking simple tasks and just doing them mindlessly to give yourself a chance to think about something else. So maybe you've got a patient going into respiratory failure. That sucks. But when you are setting up an oxygen tank, you know how to set up an oxygen tank. You know how to turn it on. You know how to make sure the NIMR breather fills up. That is not a cognitively intense task. So use that as an opportunity to think, okay, we're going to get the oxygen on them. Then we're going to reevaluate breath times. And then we're going to move on to the ambulance. You know, create that moment for yourself with those low cognitive load tasks. Another thing you can do is just literally step back. When I have cardiac arrest scenarios, one of my goals is to get to a point where I can leave my team performing tasks that they know how to do and that they're doing well, and I can physically take a step back to reevaluate the decisions that we've made, the pathways that we've gone down, and the steps that we need to take to continue the resuscitation. And that might be going and talking to family, or just preparing equipment for the next intervention. But I try to remove myself so that my head is more clear for when I'm ready to re-engage. Another thing that you can do is if you're using a checklist, or if you have a stressful situation, you can kind of engineer a stop point. So our intubation checklists have a stop point right after you've prepared everything. So you've got all your equipment ready, the patient's pre-oxygenated. Before you start doing it, you stop and say, okay, we're all on the same page, we've got everything, okay, we're good to go. This is something that happens in every surgical suite before an operation. There's a timeout. And the reason they do that is to make sure that they know what they're doing, and that everyone's ready to do it well, so that when they engage, they're good to go. So, how to optimize your performance. Know what you're doing, first of all. Have your skills, have your knowledge base. Then offload or prepare yourself as much as possible. And then if you find yourself in that stressful situation, know to move through phases of engagement and disengagement, on and off. And if you're getting ready to be on, know how that's going to affect you. Know how the stress is going to change your ability to perform. And also, how you can beat the stress. How you can use certain skills, breathing, seeing, talking, focusing, to bring that challenge down to a level where your skill can meet it. And practice it. And practice it deliberately. So, I'm going to use you guys as guinea pigs for a minute. What we're going to do real quick is a guided meditation of sorts. And what I want you to do is kind of relax, kind of let me take you to a different place. And I'm going to cue you at a couple of points. And just say what kind of mantras or trigger words, and I'll obviously make it clear what we're talking about, but just say what's going through your head, what you might do in this actual situation to prepare yourself, to bring yourself down to a place where you can do your best. Does that sound all right? And I'm going to have you open your eyes at one point. It's going to be kind of a gory picture. If you feel like you're going to lose your open, maybe don't open your eyes. Okay, here we go. So you're working a BLS level 911 transporting ambulance when you receive a call for a 7-year-old female patient who fell and is bleeding. After grabbing your stethoscope from the table in front of you, you hop in the passenger seat of the ambulance next to your partner. The address is outside of town, probably 10 minutes to the closest community hospital, and your ALS backup is currently tied up on another call in a different part of town. About 5 minutes into your response, dispatch comes back on the radio and says your patient is now having a seizure and that the callers have dropped the phone. With this information, you can feel your partner become more tense and start driving faster than before. You, having just learned a great deal about performance-enhancing psychological skills, take a nice deep breath into your belly and start to plan for the call. So what's one thing that you could cognitively offload before engaging with your patient?
Get your gloves.
Gloves on. What's one medical knowledge point or assessment tool that you could prime in your head before meeting the patient?
Think that you're not turning on the left side. Getting ready.
So you arrive on scene, a small 2-story house at the end of a dirt road. You find a frantic-looking woman on the phone waving you inside. After reviewing with your partner what equipment you're grabbing, you walk inside, holding yourself high, shoulders back, head up, and you take another deep belly breath through your nose. From the bottom of the stairs, you can hear the sound of an obviously distressed man's voice saying, "It's okay, Taylor, it's okay." And you follow those sounds to a bedroom at the end of a short hallway. From the bottom of the stairs, you can hear the sound. As you enter, you see a pair of bunk beds straight ahead of you, with a tall bureau directly next to it. Kneeling in front of the bunk is who you assume to be the patient's father, with a small pair of twitching legs just beyond him. You very calmly tell him your name and ask for some space to start assessing your patient. She's a mess. It appears, go ahead and open your eyes, as though she fell from the top bunk and struck her face against the sharp edge of the bureau beside the bed before falling the rest of the 5 feet to the floor. She has apparently damaged a portion of her hard palate, and there's blood and teeth in her airway. She takes short, ineffective breaths during her seizure activity. Kneeling beside your patient's head, you direct your partner to hold the patient's cervical spine as you turn to the equipment you brought in. Taking a deep breath, you mechanically open the suction and pull your airway back from the jump kit. As your hands move of their own accord, you have time to think and visualize what you have to do. What might you visualize to manage this airway?
Suction. Moving things out the way.
So you
Blow by oxygen, maybe.
Yeah. So, you visualize suctioning while withdrawing, inserting the airway adjunct, supplementing the respiratory effort as necessary, continuing your rapid evaluation, transporting. Even though you've never dealt with an airway this bad, you know what you have to do and how to do it. Instead of letting the idea of failure enter your head, you tell yourself you can do it. What kind of self-talk might you use? What kind of That's good. You turn back with your equipment prepared, and you trigger yourself into action. What kind of trigger word might you use?
Let's get going. Here we go.
Well, you suction the patient's airway, your seizure activity stops, and in the time that it takes to place the OPA, patient begins to have a better respiratory effort. You place her on high flow O2 and easily move her down the stairs and into the ambulance, where she continues to wake up on the way to the ED. So, I don't know how much you can feel those techniques being effective when you're just saying them. But if you, I would encourage you the next time you have a call, the next time you hear your tones drop, check your pulse, take a deep breath, and think about what you're going to do, what you might have to do, what's the worst possible thing that could happen, and how you're going to overcome it. If you guys who have the evaluations wouldn't mind just writing down one thing that you can take away from this talk, or one thing that you're taking away, and one thing that, I do have one more, so I'm over here one bit. But if there's one thing that could have been better, I'd like to know. This may be something that I do in the future. In the time that we have left, do you guys have any questions or comments or things that you feel like you you'd like to talk about?
I was just gonna say, we talked about the breathing exercise like 2 years ago
Yeah.
at this conference, and I was using it. It's really nice when you're in surgery because you can hear the patient's heart rate, and it's usually around 60. So it's just like breathing with the heart rate. So, well, for the first like 2 or 3 surgeries I watched, so
Yeah.
it was really helpful. I also use it before my driver's exam.
Nice. That's like I said during the talk, I use various forms of these skills on a daily basis, and I think you do have to do them deliberately in order to really be able to recall them when the time when they're going to be necessary, like when the shit hits the fan. And I was just talking to some coworkers at work last night before coming here, and we were saying how, yeah, you know, people who have been in EMS for a while think that they're ready for anything and think that they've seen it all, but there's always going to be something new. There's always going to be something that puts you in a bad place. So I hope that, should that happen, you remember something of this that helps you to get your head on straight and be ready to move forward. Yeah.
What happened with patient?
Oh, I have no idea. I just found that picture online.
It took me a while to figure out which one was the top and which one's the
Yeah.
bottom.
Yeah.
It was no idea what that was.
I think the
I
top
think-
is the top.
Yeah, this is
The
I
top
think
is
this
there.
is the hard palate.
Is that the tongue? Like
That's
I
the
think
top.
this
that's
is
the
the
tongue?
tongue.
Yeah, and the
So
lip.
that's the lower and that's the chin.
Yeah.
Right there, yeah.
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 It's not good.
It was really interesting though because, like, it was, I felt the same way that I would if I was walking into a room and seeing that. Like with my eyes closed and opening it. It was, yeah.
So how exactly it happened, I didn't really get.
I don't know.